At-home COVID tests have quickly become a hot commodity, flying off store shelves across East Texas. But can they be trusted as advertised?
We're about to find out because Sarah Allegre tried it out for herself and shares everything you should know before you make that buy in this KTK special news report.
Workplaces issuing vaccine mandates to music venues requiring proof you're COVID-free. These at-home COVID test kits are in high demand.
Maybe their work is requiring them to show proof of being negative or positive. Maybe they're going to school and the school is requiring something.
Sean Sams, a pharmacist and owner of Lewis Morgan Drugs No. 4 in Longview, says these tests are hard to come by.
The availability of at-home tests is very low right now. It's almost impossible to get. If we receive any, it's maybe one or two, and by the time we put them on the shelf, they're already gone.
An affordable, simple, and convenient tool, delivering results in the privacy of your own home.
You know, everybody wants to know if they have COVID or not. They're sitting at the house, they don't feel well, they have the sniffles.
A step toward grasping the normalcy we so desperately crave.
I know it's easier for patients to be able to go into a pharmacy and pick up a test and do it at home.
But just how effective are these at-home test kits?
I personally bought some, so I can endorse the concept, right?
UT Health East Texas Chief Medical Officer Tom Cummins says rapid testing is a simple solution to help spot and stop the spread.
I think the home tests are a valuable tool to use. I do encourage people to get some if they have them. I think they're great for using before you go travel or if you're starting to have symptoms.
So we decided to pick up 2 at-home COVID-19 test kits. We picked them up from local East Texas pharmacies. We have the Binax Now as well as the QuickView at-home COVID-19 test, ones that pharmacists say are flying off the shelves right now. All right, let's get started.
Remove the swab from the tube by rubbing the swab head against the inside wall of the tube.
Experiencing some minor cold-like symptoms at the time, I started my experiment with the Binax Now, a price tag landing buyers at $23.99.
Arrow pointing down.
One of the first at-home rapid antigen tests to earn FDA authorization, however, still lacks the green light of approval.
Basically, it's a way for them to get the product to the shelf or to the market, to the public, without going through the full studies that that would typically be done for a full approval.
There are 3 types of testing: molecular, antigen, and antibody. The antigen, a more rapid option, yet less likely to pinpoint the virus compared to its lab counterparts. Nearly 2/3 as effective in symptomatic patients, and for those not showing symptoms, only 1/3 of results can be trusted, according to the CDC.
There are a lot of manipulation problems where you can contaminate your sample and not get a good result because of that, or some of them aren't just as accurate as what they need to be.
After a few easy steps and 15 minutes of waiting,
Do not remove the handles. We're going to place this.
the result: negative.
Glad to hear that.
Next, the QuickView over-the-counter kit, another rapid antigen testing option, also priced at $23.99.
And I have to do another nostril.
A nasal swab of both nostrils, and 10 minutes later comes the results. Again, negative. Another effortless option if you could find it in stock.
As the COVID numbers decreased in February, their production decreased, and it's taken them a little while to get ramped back up and make them widely available.
The Biden administration announced its plans to make at-home testing more available and affordable.
Ratchet down the price so people don't have to pay $15 for a test. We're trying to get that down into single digits quickly.
Especially following the president's recent mandates, driving up demand.
There has been a lot of issues from the manufacturers as far as being able to get them out to all the pharmacies and different grocery stores and things like that would normally carry them.
The at-home style test is a do-it-yourself option, suggesting an honor system approach where people would self-report a positive result, raising concerns that we may be underreporting COVID cases in our area.
If more people are testing at home and getting the positive result, and if they don't do anything about it, they don't go see a physician, they don't get another test, those numbers aren't being recorded, and that can cause some underreporting of active cases.
A follow-up with your doctor is recommended, especially if you test positive.
But at least make your physician aware so that if you have issues or problems, they can help address those.
So we did, and tested once more with the pharmacy.
Here you go. Thank you very much.
The result: negative. Sarah Allegre, KDK News.
$70 million of investment from the National Institutes of Health is bringing more tests to the market, funded through the American Rescue Plan passed earlier this year.